The next Ames, November 2017, scoring up. What is the shape of the trapezius muscle? I am telling you now, there are some questions if you don't prepare also, no problem. Exam hall, suddenly you will be having an examiner walking, no? Hey, please wait. My NEET PG, my seat, my life. Then you can quickly check what is the shape of his or her trapezius and can be able to answer in the exam hall, right? Please don't expect to do that. Triangular is the shape, as all of you know very well. Jodha Akbar movie you have seen, huh? The powerful trapezius you can classically see. So what does trapezius basically does? It extends the head, adducts, elevates or depress the scapula. So that is the function of the Jodha Akbar's trapezius is what you need to remember. I think the easiest question in the Ames ever was this triangular shape of the trapezius. Okay. Now, what is this muscle marked? In the, this is the tongue, base of the skull, these are the jaw, and what is this muscle that you are able to see is the examiner's question. So that you need to be doubly sure about. So doctor, it is the lateral pterygoid, and the lateral pterygoid is the one which will be opening the jaw, is what need to be remembered. So mandible depresses, opens the mouth. Mandible elevates, closes the mouth. Mandible protrudes and mandible retracts, and mandible can make the side to side movement. So the depression of the mandible with the opening of the mouth, lateral pterygoid. Elevation of the mandible and closure of the mouth, you need masseter, temporalis and medial pterygoid. And protrusion of the mandible, you require both lateral and medial pterygoid. And retraction is because of the posterior fibers of temporalis. And side to side movement, it is once more the lateral and the medial pterygoid is what you have to fundamentally remember. Now, the dense, irregular collagen fibers are found in which of these various anatomical structures? Can you expect this question and can you prepare and go and answer this question? No way, no way. So be very much ready, doctor. Out of 300 questions, only 240 questions you can actually prepare, anticipate, go and attack. Remaining 60, all common sense. Govinda, Govinda kind of questions. So there is a reason, don't make your heart very sad while you are preparing that. I should remember this, I should remember that also. No, no, no. It all cannot happen. Every exam paper if you take, around 60 to 70 out of 300 questions are like bakwas questions. It's very difficult. It's only situational common sense that you need to basically use. But 240 questions, that is almost all 80% of the question paper in a 300 marks paper. Yes, you have to do hamla on the question and win it. That is the deal that we all have, right? Dermis. So this is the dense, irregular connective tissue in the dermis, where there are a lot of fibroblasts with the collagen fibers in different planes, is what you are able to see. Now, holocrine type of cells. Which one among these is a holocrine type of a cell? First of all, you must know what is paracrine, miracrine, holocrine kind of a gland. Holocrine kind of a gland is a sebaceous gland basically. So here what you can see is a hair follicle and a sebaceous gland here. This is the sweat gland. It is the sebaceous gland which is considered to be the holocrine gland. Once more, a situational memory that you should be able to remember. Now doctor, this is the hair follicle sebaceous glands, and these are the sweat glands. So what is meant by holocrine secretion? The secretory cell gradually fills with the secretion. The cell organelles degenerate, the cell dies, and its membrane breaks, and the secretum empties. This is called holocrine secretion. You have studied for NEET PG so much that you yourself got digested. That is holocrine preparation. Please don't do that. You don't need to do that. Right? Seriously, 3 months, study for 300 hours, and out of the 300 questions in entrance NEET PG, you can easily crack 240 and you should be in the top 300 ranks. That is our deal. इतना पढ़ के बड़ा ranks आना very bad. That is not our deal. Okay. So read focus, read little, be very precise. Coolly you can go and crack the exam, provided last 15 years DNB, AIMS, PGI, JIPMA, एक बार मिक्सी में डाल के खत्म कर देना last 15 years papers. And we have all those video discussions. Let me promise you, doc, on the U-Medico, which we have discussed, all those topics question wise. First time it will be a surprise. Second time you know what's happening, and third time, oh, you don't need to care, and reflexly you will start answering. You don't need more than 200-300 hours of time to be spent for preparation. So what is merocrine secretion? Whenever the secretory process occurs by exocytosis, where the secretory cells remains intact, unlike in the holocrine, and most of the glands, it is a merocrine kind of a secretion, like an exocrine pancreas, submandibular gland is what you have to basically remember. So a mature cell dies and becomes secretory product. What is this called as? This is called holocrine secretion. Now doctor, the next question of the AIMS November. The base of the skull has been given to you, and this is the superior orbital fissure into which a nerve is passing. What are the contents of the superior orbital fissure? Recently we discussed in the PGI paper, na? Ophthalmology mein. You remember, right? So which one it is? It is the abducent nerve, which is the constituent of the superior orbital fissure. One of the favorite questions of the examiner. Inferior orbital fissure, superior orbital fissure. What are the contents? And between the superior orbital fissure, what are the contents above the angle of the circle of Jin, and within the circle of Jin is an important question. So if you take the 6th cranial nerve, already we discussed now, midbrain से क्या निकलेगा? 3rd, 4th cranial nerves. Pons से क्या निकलेगा? 5th, 6th, 7th cranial nerves. Medulla से क्या निकलेगा? बाकी जो भी है, they will all come out of medulla. So 3rd, 4th from midbrain, 5, 6, 7 from pons, and abducens is 6th. So it comes from the pons, and it will be passing through the cavernous sinus, then through the superior orbital fissure it passes, enters, passes through the annulus of Jin, and then goes and innervates the lateral rectus muscle. So this is the journey between the pons to the lateral rectus muscle for your 6th cranial nerve. The abducens is what you need to basically remember. Superficial reflexes and deep tendon reflexes. Knee joint का कितना है, elbow joint का कितना है, supinator reflex का कितना है. All these values, doctor, please don't forget. You did this wrong, or you are little shaky about this, make it a point, bookmark this topic, that you are going to definitely revise it. We have got a wonderful topic in neurology called root values in the video library on the U-Medico app. So please don't forget to review that. So doctor, corneal reflex is Afferent is trigeminal, efferent is facial, which closes your eye. Palatal reflex is 9th and 10th cranial nerves, as all of you know very well. Scapular, C5 to T1. Abdominal, T7 to T12. Cremastric, L1 to L2. Plantar, L5 to S1. And bulbocavernosus, typically in the case of the trauma, spinal cord injury, you will be eliciting the bulbocavernosus to know the anatomical level of the possible lesion. Anyway, MRI will tell you, but before that. And anal is also S3 to S4 is what you should not basically forget. Yesterday I told you an easy way to remember. Entire sole dermatome, what is the sole, is innervated by S1. Little toe is by the, how much? S1, and large toe is by L5 is what you have to remember.